and Maryellen asks, what can we expect in 2023 to 2025 if we're part of an MSSP ACO that is using web interface?
Great question, Maryellen. And obviously, you're thinking about the APM performance pathway, the APP, that is now in place and is now kind of holds the quality measurement standards for MSSP ACOs. In these next couple of years, keep web interface temporarily as an option to produce quality measures. So if you're doing web interface, there's 10 measures that you're required to get from. Most people use chart abstraction to get that data from their EHRs. Once the web interface sunsets for the 2025 performance year, then you can produce there's three measures you can produce either with ECQMs or MIPS CQMs. So if you're staying with web interface in 2023 and 2024, things won't look much different to you than they always have. Each January, when the ACO gets its patient list from Medicare, you in turn will get a list of the patients that are yours, and you'll pull the charts and score the measures and contribute your performance spreadsheet to the ACO to combine into the total submission. Now, behind that, there are some things you may experience. The quality performance standard is staying at 30% for 2023, but in 2024, that performance standard goes up to 40%. So that may reduce your chances of your ACO collecting on their shared savings or protecting from the full shared losses if they don't reach that measurement. Medicare estimates that about 40% of practices will have difficulty hitting the new standard when it's in place in 2024. And of course, if you're doing the web interface, it'll be applied in the standard way, which is the 40%, 30% in 2023, 40% in 2024. Represents the aggregate score across all the quality measures, the 10 web interface measures, the two administrative claims measures that Medicare calculates, and the CAPS survey score that's required. Now, people who move early to ECQMs or MIPS CQMs, that is before web interface finally sunsets in its expected year for the 2025 performance year, those get a break on the performance standard. Instead of your aggregate score having to be 30% for 2023 or 40% for 2024, only one of your measures has to hit that 40% or 30% goal, with one additional outcome measure being at least 10%. Now, of course, you can score higher than that on all your measures, but it really means that you've got a break, and you don't have to have your scores as high as across the board as the web interface people do. So I think there's lots of reason to change early, but if you're staying in web interface, you really shouldn't notice much different in your day-to-day work and even your year-end quality reporting work than it's been right along until you actually make that change to the ECQMs or MIPS CQMs.